And I know pediatricians, have been saying this mental health crisis among our kids has become a national emergency. Our schools dealing with now grief and anxiety and depression in children and what they experienced during this pandemic, and that it's kind of bubbling over into our classrooms. I know you've been trying to work with schools.
Yes, exactly. And just yesterday, I was speaking to a superintendent who was sharing how it feels so much worse in this fall than it did last fall. And I think that, one is sort of the loss of learning, but really is that kids are coming into schools with a skills deficit. So they are, when you're at home, it's quite different from being in school. So kids are not used to being their school behavior. So they're also now experiencing anxiety because they didn't have to face any social pressure or performance pressures in the same way. So now they're faced with that. So beyond disruptive behaviors, we're seeing anxiety, we're seeing kids refusing to go to school, or being tardy, and then becoming very overwhelmed with academic pressures.
I'm also hearing about younger kids and this increase in violence and bullying to other children. And what would be the cause of that? Why would that be the manifestation of their feelings?
Well, anxiety is a reaction to what we perceive as dangerous. And the normal reaction to anxiety is to run away from anxiety when you're forced into a situation. So let's say they're coming back to school and having to deal with other teachers now and dealing with other peers, that the fight response kicks in, which means that when you're no longer able to run away, then you attack. So that could explain what's going on, and also a skills deficit because they're not used to being in school now.